Hello, hello, hello. Good afternoon, everybody. It actually is afternoon here. Normally I do this in the morning. Today I had an extra long workout, so here I am. Hello, hi. I am continuing the conversation today to talk about why your anti-inflammatory treatments aren't working. Today is a summary of the whole week's conversations. And so it's always good to summarize what we've talked about because forget to go back to something. Maybe I forgot to say something in one of the videos. So anyway, but I have some exciting news. So before I get started into why your anti-inflammatory treatments aren't working summary, I want to let you know that I am looking for 5 women who want to exercise without pain starting in February. So maybe you've tried your New Year's resolutions to get healthier and it hasn't gone the way that you've planned. Maybe you got an injury. Maybe it's just not ramping up like you want. So I am opening up 5 spots in my Move Better method for February. And I'm looking for 5 women who want to get started. So I have spots available next week for clarity calls to go over what your next steps should be and if you're a good fit. If you're a good fit, I will invite you into transformation to participate in the Move Better method. For the first 5 women who sign up for the program, you will also get a complimentary hour-long consultation with me. This is something I won't offer again. I rarely offer it. So if you're interested in coaching with me, sign up for a clarity call to see if that is the next step for you. If not, no problem. I'll let you know on the call who I recommend you go get a consultation with, what kind of treatment or program or what have you that you should do. So if you're interested in signing up for a clarity call with me, comment below and I will send you the link to schedule that call with me. It's a half hour. It's not much time and you'll be able to see if the Move Better method is the right fit for you, or if you should go work with someone else. Not a problem. It's free. No pressure to sign up or anything. So that's that. I'm opening up the 5 spots for the Move Better method in February. Okay, so now that we've gotten that taken care of, let's continue on with why your anti-inflammatory treatments are not working. So on Monday, we talked about cortisone injections. Cortisone injections may not be working for you anymore or ever because you're doing localized treatment for a global problem. You're trying to give an anti-inflammatory medication just to your knee when in fact the inflammation isn't even in your knee anymore. It's now your whole body. So that's why cortisone injections may not be working for you anymore or ever. On Tuesday, I talked about ibuprofen. So ibuprofen would help a global problem if you have global inflammation, not the localized inflammation, but you may not be taking the correct dosage of the medication. The threshold for pain relief is much lower than the anti-inflammatory threshold. So if you want an anti-inflammatory relief from your ibuprofen, you need to take more medication than what you're taking for a pain relief. To find out how much ibuprofen you should be taking, you can talk to your pharmacist or you can talk to your physician. It's outside my scope of practice to tell you how much to take. So you could also, if you're taking the medication, not be taking enough of it. So you could have built up a tolerance. Maybe you've been taking, I gave the example, Melissa was taking 2 pills. Well, maybe her body got used to that and built up a tolerance. So now she needs to take 3 or 4 or more pills to be able to have the same effect. So your ibuprofen might not be working because you're not taking enough to even reach the anti-inflammatory threshold, or maybe you were, but now your body has gotten used to it and now that has raised up even more. So that's why ibuprofen wouldn't be working for you anymore. On Wednesday, I talked about creams and ice. And each time I read this, I think it says ice cream, but it's ice and creams. So ice and creams, just like the cortisone, aren't good and aren't going to work for a global problem. So if you have global inflammation, whole body inflammation, systemic inflammation, putting ice or cream on a localized area is not going to have an effect. Icing your knee is not going to do anything but numb it up if you're having whole body inflammation. Same thing with the cream. If you rub BioFreeze or you rub Deep Blue over your knee, but you have systemic global inflammation, it's not going to touch it. And also with the cream, it only goes so deep. So if you are putting the cream on an area, but the cream can't seep deep enough to get to the origin of the inflammation, it's also not going to do anything for you. I mentioned on Wednesday that I don't like the cream for joint pain. I like the cream more for muscle soreness and tenderness from a workout. So, and Deep Blue's my go-to. It's my favorite. I use that on sore muscles after a good workout. And then finally, yesterday, I talked about not taking advantage of your pain-free time period to strength train to prevent the problem from coming back. So if you get a cortisone injection and it helps with the pain, let's say you get a cortisone injection in your knee and it helps with the pain, but you don't take advantage of that pain-free time period to strengthen the surrounding muscles, to formulate a good exercise program to strengthen up and make the areas around it more flexible, your back, your hips, your ankles, your knees themselves, then you're not going to prevent the problem from coming back. You're just going to have some pain relief for a couple of months. You're going to have to go back for the cortisone injections in another couple of months again. So if you take advantage of that pain-free time to really formulate an exercise program, you're going to be able to prevent that problem from coming back, or at least if it does come back, to a lesser extent, less likely to need those cortisone injections, more likely to be able to do some at-home remedies. So there you have it. 4 reasons why your anti-inflammatory treatments aren't working. So I hope everybody has a great rest of your day. If you're looking to sign up with a clarity call to figure out what your next steps are from me, either working with me, you're curious about that, or maybe you are just curious on if you should go to physical therapy or if you should go to a chiropractor or sign up with a personal trainer or just look up some YouTube videos online. Sign up for the call. It's no pressure situation. Of course, I'd be happy to have you come join us in the program, but it's not for everybody. And I totally get that. So if you're interested, leave a comment below and I'll send you the link. Have a great rest of your day and a great weekend.